Thank you so much for joining the podcast. Super excited to have you here. Let's start with the first question. Can you share a little bit more about your journey and also what led you into starting your company, Menda Health?
Absolutely. Well, thanks for having me, Maria. I appreciate it.
Of
Um,
course.
I can start maybe about 10 years ago. I developed chronic back pain,
Oh my
and
goodness.
it started in my lower back and then
Okay.
spread to other areas of my body, even though I was following all the doctor's recommendations,
Mm-hmm.
which is typically, physical therapy, which I did
Yeah.
for a year, and injections, maybe some medications. I was taking these muscle relaxants,
Mm-hmm.
and these back spasms and pain weren't really going away. So I
Okay.
was starting to feel hopeless, and that was kind of the beginning of this multi-year journey. Um, I'm skipping a few steps, but
Of course.
that it's a pretty hard experience for anyone to go through, and we treat a lot of patients at Menda who come in with very similar stories and similar experiences where they don't feel heard by their
Yeah.
medical providers. They don't feel understood. They
Yeah.
feel hopeless. So all of that. And I feel fortunate and lucky that I kind of stumbled upon more modern pain neuroscience
Mm-hmm.
research. And it's a mouthful. But what it really boils down to, and the modern research of pain has evolved a lot beyond the what's called the Descartes model,
Mm-hmm.
which was back in the 1900s. You may know that philosopher Descartes, who said basically if something hurts, then there must be something wrong in that
Mm-hmm.
part of the body.
Mm-hmm.
And before I get too deep into the science, I started kind of following one thing after the next, and thankfully was able to find a more whole body solution that really helped
Mm-hmm.
me get better and get back on my feet. And I can talk more about the science and more about the treatment. But that's really why I started Menda Health 5 years ago now with two other co-founders to bring more of this modern pain neuroscience, pain psychology approach to more people because it's actually recommended in medical guidelines for almost everybody with pain more than 3 months. So as much as actually physical therapy, but only 3.8% of people get access to these kinds of pain psychology or mind body or holistic kind of treatments for pain.
Mm-hmm. I love what you're doing because actually I had will have the same issue as you. I've been experiencing chronic back pain for 3.5 years now. Not in the lower back, but in the upper back, my left side only. I do hear that most of the people have it mostly in the lower back, which is interesting. I've been on the same pathway as you've been. I've done it all. I've done physical therapy, I've done shots, I've done um, PRP, stem cells. Um, I've also worked with a psychologist on the matter. What else? I've changed my lifestyle a lot. It, doing different types of trainings. Like I used to do CrossFit before, I cannot do that anymore. Um, but all the gadgets, everything. Finally, actually, 4 weeks ago, I finally got surgery. Because my doctor, he was saying no, you don't need surgery. I cannot do anything, and I actually changed doctors. Finally, this other doctor approved the surgery. I've been feeling a little bit better. However, I still feel a little bit of the pain here. So it's something that I am excited about, but I am still like on the path. So super interesting
Yeah,
to hear
yeah,
about your company, and I will actually, I'm super excited to learn more.
yeah. And as it's a pretty frustrating,
Yes, yes,
hopeless, long journey.
yes.
And the surgical route can be for some people, not for
Hmm.
everybody. So yeah, I mean it's a
Correct.
very individual experience as well.
Hmm.
Um,
Hmm.
so sorry to hear that you've been going through that, and happy to
Thank you.
talk more. Happy to kind of chat after this as well, if that could be helpful.
Absolutely. Thank you. Okay. And are you still experiencing your pain, or is it gotten much better?
Yeah, so it's a interesting question, and I know people want to often hear a very black and white answer, like
Right.
there's no pain anymore or
Right.
there is pain.
Hmm.
And it's almost a little more complex or intricate than that.
Hmm. Hmm.
I don't experience pain anymore, which is
Beautiful.
again very grateful for, and I'm
Yeah.
able to do anything physically that I want, which is night and day. I mean, I had
A hundred
stopped
percent.
almost all activities. I couldn't walk for more than 10 minutes
Oh wow.
for about a year,
Damn.
and so I'm fully back on my feet. I biked an hour the the other day, like 2 weekends ago for July 4th, and I was fine.
Nice.
Doing
Nice.
like 20 miles on the bike, and I also have days where the pain comes back, and what I know now and what's different about my approach is that maybe historically 4 or 5 years ago, when the pain would come, I would do everything and anything that I could to get rid of it. Right? Natural, normal human
Yeah. Yeah.
experience. I
Uh-huh.
don't want this to be there. I'm gonna go for a massage. I'm
Yeah.
gonna take a medication. I'm gonna do all these things. I'm gonna maybe even panic, contact my doctor.
Hmm.
Um, and it's been a journey, and it's been a learning, and it started with a lot of education to understand that the pain for me meant I'm not broken.
Hmm.
Um, a lot of this modern pain research talks about how our brain actually creates all the pain that we feel, whether
Yeah.
you break an ankle or the pain goes on for 6 months or 10 years, whether it's back pain, migraines, fibromyalgia, or some other nerve pain. All of it is created by the brain. It's not in your head, but it is created by the brain.
Hmm.
And the brain plays a really important role, the brain and the nervous system, in processing those pain pathways and creating the experience of pain. And so, what I've learned for myself is the more that I panic, the more that I fear, the more that I worry when I start to feel something, um, the more my pathways start to flare
React.
up and activate. And so, it's almost similar to if you're a surfer or you go into the beach and you go into the water, and let's say a wave takes you under. What they teach you to do is not to panic,
Hmm.
right? Because when you start panicking, then you actually lose your breath very quickly.
Hmm.
Um, and so when I do have those days where the pain is there, I'm asking myself very different questions. I'm not saying what should I not do today. The question is what's actually happening in my life that's showing up in my body, and how do I respond differently to that?
Hmm.
And it's often what I've found. I had an argument with someone, or someone
Okay.
said something to me that I didn't like, and I'm feeling angry about it.
Hmm.
And I know this sounds all crazy, but the research and the science is actually very strong and very clear, and becoming um, more clear kind of year over year. So
Hmm.
that's kind of been my experience, and what we see with a lot of people that come to us as well.
Love it. Because, yeah, 100%. A lot of the situations in life um, depends a lot on how you react. Um, so it's just not pain, but anything. And you have to, it's not an easy thing to do. It's something that you have to practice and practice and practice. And with time, hopefully, just become better at that. Okay, what
Yeah.
has been one of the most rewarding moments in your career so far?
Oh wow. You know this probably firsthand more than some people. The the founding journey or the business journey of creating something from scratch is a tough one, right?
Oh,
It's
yeah.
full with a lot of doubt and a lot of fear and worry about am I going to succeed? Can I pay my
Uh-huh.
employees next month? All these kind of thoughts going through our heads,
100%.
and I've been through those ups and downs, and for me, that's I feel like normal at this point.
Uh,
I had an experience a couple months ago where in the morning I got a message from one of my colleagues, and she was relaying a message from a patient of ours who I'd actually never spoken to. So at this point, we have a team of therapists that are meeting the patients. We have medical front office and back office
mhm.
staff that are helping the patients as well, get set up in between visits. So I don't have as much interaction with the patients as
Mhm.
I did maybe in the very beginning. And that's
Yeah.
something I do miss. And so it
Okay.
was it was really nice to get this message kind of relayed from one of the patients who and because I never met this person, it was even more kind of stunning or remarkable or just out of the blue. And he said, I hope that you get back in your fighter jet cockpit and keep going, because you've
Okay.
inspired me by starting this company.
Oh
And
wow.
I don't know what he was feeling. I don't know what he was thinking in that moment.
Uh-huh.
But it was at a point where I was feeling a lot of doubt. And it's those kind of experiences. But that one in particular,
Stuck
because
with
one,
you.
it was recent, and two, it really just, I don't know, something really struck me there, and it felt like a message from both this person but from somewhere else
That you
as well.
needed.
And
Yeah.
yeah, that these kind of moments are so unique and so powerful. So yeah, just that really kind of makes me feel grateful that I've done this, been on this journey.
Mhm.
I've met a lot of really great people on our team as well, and gotten to spend a lot of time with them. So for me, those are kind of the small joys.
Yeah. No, and the small things are not small, right? So what you're doing, it's very beautiful, helping so many people that and a lot of people don't think that so many people suffer through this.
Yeah,
Okay, from I you touched a little bit about this at the beginning when you were explaining, but let's dive a little bit deeper into it. From all of your experience, how do you think that chronic pain treatments have been evolving?
yeah. So there's been a lot of new developments,
Mm-hmm.
and you were mentioning, some of the things that you tried: PRP,
Mm-hmm.
neuroablations, spinal cord stimulators. I mean, there's a lot of medical device, a lot of kind of advancements on that side. There's definitely advancements on the surgical side as well, and doing more minimally invasive stuff.
Mm-hmm.
We have a much better understanding on the mechanisms of pain, which usually the research and the understanding of the condition itself really leads to breakthroughs in how we treat things. Um, and from that perspective, some of the work that we do is more in the behavioral mind, body, or brain first kind of treatments.
Mm-hmm.
And in the last 4 years, there have been multiple studies coming out focusing on the effectiveness of these kinds of treatments. One is called pain reprocessing therapy,
Mm-hmm.
the other is called emotional awareness and expression therapy, um, which is all of that kind of the underlying kind of research around the brain being the generator of pain, and how when pain goes beyond 3 to 6 months, the regions of the brain change. So it's not the same condition anymore.
Okay.
Um, those studies, kind of built on that kind of understanding and research, have been very effective. They actually took a group of 151 patients with back pain, um, who had been in pain for an average of 10 years,
Oh wow.
and they put them through a 4 week treatment of something called pain reprocessing therapy. And after 4 weeks, two-thirds of the patients, so 66%, were pain free at the end of 4 weeks.
Wow.
And with no treatment after that, they measured them 1 year later, and those same people were pain free, all of them.
Oh wow.
So
That's awesome.
we've really advanced our understanding
Mhm.
of how pain works, where it comes from, why it persists, for whom these kind of treatments are better than, for someone else. And
Right.
that really kind of gives me hope and gives me encouragement. And it's amazing to see that in these randomized controlled trial settings, which is, the gold standard of research,
Mhm.
we're able to see such effectiveness of these kind of treatments, which proves multiple things. One, that the research is, our understanding of pain is actually accurate.
Mhm.
And two, that there is hope for millions and millions of people around the world who are suffering with these conditions.
Right.
Um, and, you know, if we can build awareness and we can build accessibility, then we can get more and more people who have been suffering for multiple years, into a place where they're more functional and hopefully enjoying their life.
And I saw in your LinkedIn profile, it's awesome that you guys accept insurance because, like, from my experience, there was a lot of places like this that you there was no insurance accepted. So a lot of the times, the only thing that insurance accepts is just the medicines and just the very typical path that we know it's not working for a lot of people. So great that your company does it, and I think it's also a call for people to start understanding that this is working, and for the insurance companies hopefully to start opening up a little bit more the companies that they work with and accept.
Yeah, yeah. That we didn't start that route, and
Mm-hmm.
after about a year and a half, 2 years, we decided to take insurance based
Great.
on patients that were coming to us,
Uh-huh.
and it's been amazing since then. Just night and day,
Mm-hmm.
and we see about um, maybe 50% Medicare, people who are 65 plus or on disability, who can't afford more than
Correct.
that.
Uh-huh.
Um, and so it's been great for us and for hopefully for the patients
Mm-hmm.
that we exist and we offer that.
Super. Good to hear. Okay, for founders that are looking to innovate or go into the space of healthcare, um, do you think there's anything that they often overlook?
Probably lots of things, and I would fall into that category as well.
Okay.
Um, it's a journey, and you don't know everything. You don't even know what you don't know, especially
Right.
when you start out. You kind of learn along the way. Um, if I were to pick, uh, one or two things to focus on or to answer, I would say one, that healthcare is a little different than other
Mhm.
tech areas. There is a reason for the regulation and for the more um, risk adverse approach, which is that you're dealing with people and you're dealing with people's lives and with their health, and each person deserves to be treated with that kind of care.
Mhm.
Um, so I'd say that's one thing that people often don't understand, because a lot of people come from building other tech products, working in software, and even if you're building software for healthcare, it's not the same.
Mhm.
Um, so I'd say that's one, and then the other is the hardest part of healthcare is the reimbursement and the billing side of things.
Okay.
And what's different is, let's say you're starting in a company and you're going to sell to um, farmers. Typically, the service that you provide will be paid for by the person that you're providing the service to,
Mhm.
right? So if you're kind of selling them fertilizer, they're paying for that directly. The cost of that is very clear, it's upfront.
Right.
In healthcare, it's complex because the people who are paying for their services are not the same people who receive their services. Or
Correct.
there's some sort of sharing of that
Uh-huh.
payment, which are called copays in
Uh-huh.
the United States. And so it makes it tricky, and you do have to factor in one more thing, which is even if you're providing something valuable, is there a very clear mechanism for payment? How much is that going to cost the company to actually get off the ground and run, whether it's you're getting your own insurance contracts,
Mhm.
um, you have to get liability insurance, you have to hire licensed people. So the economics of it are important.
Mhm.
And that was something that, we took even too long to kind of understand and figure out.
Understand. Okay.
And it's still an ongoing, evolving discussion always.
Mhm.
And so I'd say those are two things that health entrepreneurs kind of often don't know when they're starting out.
And also, I'm not sure if this is right, but I think there maybe is also a time range of getting paid. Because I don't know if the insurance companies pay you right away or if they can take maybe 30 days to pay you or even longer than that. Is that accurate?
That is,
Uh
yeah.
huh.
So
Okay.
the whole billing cycle, the revenue cycle management is an entire area that I know way too much about, more than I ever thought I would.
Uh-huh.
Yes, so that's one of the challenges. The other is that they'll often pay via a virtual credit card, or they'll pay,
Mm.
or something will be sitting in their queue for longer than you think. And so these are just challenges with the kind of business model and understanding the nuances of it. Um,
Mm-hmm.
and there are people who specialize in RCM and medical billing. Important to kind of bring them in.
Correct. Okay, got it. What change would you like to see in the chronic pain space in the next 5 or 10 years?
I've probably already answered this, I think, a few times in different ways, but my hope is that we start to see more and more that chronic pain is treatable.
Mm-hmm.
It's a different condition than acute pain.
Mm-hmm.
It's not the same thing as acute pain that goes on for long. It's actually an entirely different condition. And the new diagnosis codes, which is called ICD, um, and so ICD-11 is kind of the new edition that's come out. They've, for the first time, categorized chronic pain as a condition in and of itself,
Mm-hmm.
and that's split into two different buckets. One is chronic primary pain, the other is chronic secondary pain. And primary pain means the pain is the symptom and it's the cause, meaning that there's no structural or physical findings that equate to the severity or the location or the um, intensity or duration that people feel.
Yeah.
And the research is showing that actually, for chronic pain patients across the world, about 85% have chronic primary pain. Yet we still poke and prod
Mm-hmm.
and do all these things that are actually incredibly expensive
Yeah.
and not very effective. We spend in the US $650 million treating chronic pain, which is more than heart disease and cancer combined.
Wow.
And we still have more cases of chronic pain emerging every day, every week than depression.
Wow.
So we're spending more and more, and the problem's getting worse. So something's missing,
Uh-huh.
and I hope that we, as a in a kind of system, and maybe it starts with individual people, can open themselves up to understanding things in a different way, to looking
Mm.
at it in a different way, to really looking at the research and being open minded to kind of this new way of treating things. And it will be a big shift in the status quo. There will be some people
Yeah.
who make their money from doing the poking and prodding, um, and who have to really maybe change their approach or treat a smaller group of people.
Right.
So change is always hard, but my hope is that we can really see that for what it is, because there are a lot of people who are struggling and suffering, and we're not doing them any service by continuing to poke and prod and promise that, you know, this is going to be the cure and that's going to be the cure.
100%. Yeah, because it's a very It's time consuming, it's energy consuming, it's financially consuming, and it's just very scary to try a bunch of different things and seeing nothing working. So actually, yeah, you are doing a disservice by just making the person more hopeless, even though that's maybe not what people intend to. um, but it's happening what because people are not understanding the why this is happening. Mhm.
Yep.
Okay, let's now talk a little bit about your business and digital marketing. Uh, have you seen specific digital marketing, I don't know, strategies or platforms that have worked better for your business?
So we don't do that much digital marketing
Okay.
today.
Hmm.
We're mostly based on referrals.
Got
We
it.
go out into the communities and meet doctors, health systems, clinics. We partner with them to really service these patients and to help relieve the burden, or share the burden
Hmm.
of treating them. So yeah, we that's been our model so far, and there are pros and cons to that. I think the nice part is the doctors are well-meaning for the most part. They do want their patients to get better. They are more than happy that someone like Menda exists and
Hmm.
can help patients with the behavioral side of things. Because what we hear over and over again is, I don't have time to sit with a patient to hear their story.
Right.
I don't have time to. That's just not how my day is set up, and so they're kind of handcuffed as well.
Mhm, they are, yeah.
And so we like to work with the doctors who really feel that, who can see the benefit of adding on this kind of care to the treatment plan, and um, yeah, I think on the digital or the kind of direct to people marketing, that's been less of our approach so far. Typically, medicine's really built around the doctors.
Got it. And are you guys looking to expand in the near future or now into that? Or because sometimes I know what happens is that businesses are a little bit busy with the referrals, and sometimes when you're like so busy it's hard to think on expanding, but it's also something that you should think about. So I guess that's where you guys are now are at right now, I would say.
Yeah, yeah, we are thinking about it a little bit more, and would love to brainstorm, with you on ideas there,
Hmm.
and just think about how we could, reach more people that way.
That's awesome. Okay, yeah. So thank you so much for joining the podcast. I love talking to you and learning more about Menda Health and about your experience because it's great that well, it's of course not awesome that you had chronic pain, but it's awesome that you understand it firsthand and that you created this. Because a lot of the times, like again, like yeah, a doctor that's treating it probably has never dealt with it, so doesn't understand it fully, and that was my experience as well. So it's awesome that you get it and that you explain it to your employees. I don't know if maybe your employees have had it as well. So I love what you're doing and thank you so much. I learned a lot. It was great talking to you.
Thanks, Maria. I appreciate you having me on and taking the time.
Of course.